Hello, hello, and welcome to a brand new episode of the Empower MEN podcast. I am super excited here to have today Kate, who we connected back in the early summer, and we both attended a patient conference run by a charity that supports patients with the MEN conditions and other ones as well. And I kind of kept in touch with Kate after that. Kate runs an Instagram and has lots of different things going on there. And part of what she shares about is her health journey and what her health journey has been over the past few years. And I thought she'd be an amazing person to come on and share her story, share her journey, and anything that she's learned that might help you expand your horizons with whatever you're dealing with at the moment in terms of your health and your life in general. So, hi, Kate.
Hi, Lizzie. Thank you for having me on.
Thank you for coming on. It's such a pleasure. So tell us, I mean, your your health journey over the past few years is not linear in any sense. It's been really quite colourful, and that's not just for you, but that's for your family as well. And I wondered if you'd, in as much as little detail as you like, and in as far as you're comfortable, if you'd share with us kind of what that's been like over the past few years, and where you started and where you are now.
Yeah. So I guess it kicked off probably about 3, 4 years ago. I was getting really tired. It turned out I was anemic. I thought it was hormonal and everything, and I had all the blood tests and everything. But it turns out that I was severely anemic, and my ferritin was at 3. I had a phone call straight away from a doctor saying, "How are you still standing? What's going on?" I was like, "Well, I have no clue," you know. So I ended up being put under a gastro for my anemia. Had iron infusions, and whenever I've had iron infusions, it always drops back down. I don't seem to My body doesn't seem to retain iron. It doesn't seem to store iron very well. And they haven't got to the bottom of that still, like 3, 4 years on. And I think my gastro was getting quite. I think he thought I was putting on my symptoms like brain fog and saying I was having to have a nap every day. I think he just thought I was just being pathetic, and I could just tell and sense in his voice. And then it was the September of 2021. Um, I'd I'd done a wedding. I'm a wedding florist. I've had my own wedding flower business for almost 20 years, and I was actually doing a friend's wedding in the June of 21. And it was a very small wedding. We're just coming out of the pandemic. You're only allowed 30 guests, I think. But they went big on the flowers, and because it's a friend's wedding, you invest more of yourself. You just want it to be perfect, even more so than a normal wedding sort of thing. And I woke up I was having like zombie apocalypse dreams one night as well. And I told my friend this. I was like, and I knew that I was stressed about this wedding sort of thing and investing myself. But I woke up in the middle of, I think it was the night before the wedding, and I had like this excruciating pain above my left kidney. And I was thinking appendix, and I had no idea of anatomy. And then I thought, it's not appendix, that's not there. And it lasted about half an hour, but I had to properly like breathe through it. And it was like labor pains. It was that bad that it was like breathing through labor pains. And then it just stopped, and I never had that pain again. I had a gastro appointment then in September, and he just said, "Oh, have you had any stomach pains or other things going on?" I was like, "Oh, actually, I woke up in the middle of the night randomly in June with this pain above my left kidney." He's like, "Oh, okay. Why don't we do an MRI?" So I had an MRI. I don't think he was still expecting anything to come back, but they found a golf ball sized tumor on my left adrenal gland. And then he changed his attitude completely to me. He's like, "Whatever you want, it's fine." And then that got investigated and everything. I lit up like a Christmas tree, they said, which isn't the best phrase, I don't think, because oh my gosh, the whole body is like lighting up. And they did the whatever they do with the dye and radioactive sort of dye and stuff. And yeah, it turned out to be a pheochromocytoma. So I was booked in. I think I had my operation then early March 2022. I had that removed, but this is where yeah, like I said, it's not linear, my health journey. 2 weeks before that operation, I actually found a lump in my right breast. And I thought, it must just be a lot, it can't possibly be anything with everything else that's sort of happening. What's the chance of having another tumor somewhere in your body? It must be pretty low. So I ignored it because I knew I had my big op coming up with the adrenal being removed. And then I think it was 2 or 3 weeks post my adrenal operation, the lump was still there. I thought, okay, perhaps I ought to go and check this out. Went to my GP. They thought, oh, okay, we'll put you on a 2-week referral plan. Went to the breast clinic and was diagnosed with breast cancer as well. So I was like, okay, this is fun. And I recovered well from the adrenal surgery. I did feel like I been hit by a bus sort of thing, but actually it was fine and everything, recovered from that. And then sort of when I guess the focus wasn't anymore. They decided to do genetics, and they did a full genetic panel because of the breast cancer. They were thinking that could be genetic as well. And that obviously took a while to come back. So in the meantime, I was then going down a whole breast cancer pathway, and that was taking priority over everything else. I had mastectomy and reconstruction last July, I think it was end of July last year, 2022. And then in the autumn last year, genetics came back, and it turned out that I haven't got the BRCA or anything like that to do with breast cancer. That's just as it is. But it came back with the MEN2a, and I was the first in my family to find out that I had that sort of mutation and everything. No one's been ill in the family for anything like that. So then that sort of knock-on effect was my children, got 3 children, them being tested. My middle daughter, she has come back. She's just turned 14, and she's positive as well. The other 2 aren't. And my dad has since as well found that he's well, that's where it's sort of come from, but both his parents aren't here anymore. So we don't know any more about it, sort of thing. And my dad's early 70s, and he hasn't had any issues, and he's not actually, I think because he's that age and he's fine, he's not particularly interested in delving deeper because he's early 70s and fine, sort of thing. So yeah, that's sort of where I'm at. And then obviously I've had this lovely one. I've got another scar to add to my scars. I had this done 12 weeks ago, had my thyroidectomy done. That of all the surgeries, that was the easiest one, actually. That was quite an easy recovery. My voice has come back well. It was always slightly husky, my voice before, so that's not any different. But yeah, that's sort of where I'm at now, really, with it. But a feeling there's no more operations on the horizon. It's just sort of, I get 6 monthly MRIs, sort of eyes to thighs. I get 6 monthly bloods and the 24-hour urine collections as well. So they're pretty good at keeping an eye on me now. But yeah, it's been a whirlwind sort of two years really since it kicked off. So yeah.
It definitely sounds like a
it's worth it, like crammed into like 2 years.
Yeah, not an uncomplicated series of events there, one way or another. You mentioned about you'd had kind of these symptoms and sort of not really feeling great and that sort of thing, and going to the doctor, sort of not necessarily wanting to look into it further. I mean, obviously, at that stage, if you're experiencing what we think of as really common symptoms, like, well, they might be anything. It could be fatigue, it could be exhaustion, it could be lack of appetite, could be brain fog, any of these things. Sometimes, like, you know, it doesn't ever occur that it could be something really, really serious. I mean, was that an occurrence to you at the time? Did you ever think it would ever build into something like this?
No. And actually, you then start looking back into your history like years ago and everything. And I was looking back, and actually in my late teens, sort of early 20s, I did suffer from what I thought really was anxiety and things like that. I went on, I remember actually the doctors put me on beta blockers at that point. I sort of investigated hypnosis and acupuncture because I would flush up loads. I would have like hot flushes. I remember like abandoning my shopping. I go supermarket shopping, and I'd abandon my trolley or my basket in the supermarket over checkout because I just, it would just all come up and everything. And I just thought, I don't know what I thought that was, at all. And the doctors obviously just thought it was like an anxiety panic attack type thing. But I've never really been that. I'm not, I guess on social media I come off quite confident sort of thing, but I'm not. I'm better in a small group. I'm better one-on-one with people. I'm not great in big groups. If I have to go up on stage or anything like that to do, I'm literally like a jelly type thing. But I'm quite sort of, I guess, I don't see myself as a panicky person, and so, but I just sort of took it as what it was, and yeah, and then it sort of disappeared. And I'm sort of now thinking perhaps that was like hormone settling and all of this. And then, they say, oh, you have high blood pressure with, that's one of the signs of a pheochromocytoma. But I didn't really have, I had high blood pressure for my age apparently, but it was never flagged ever. And I've gone through 3 pregnancies, and actually looking back at those, for all 3, I was flagged for preeclampsia, but I didn't have, the symptom I had was the high blood pressure, but I didn't have the protein in the urine. So now I'm thinking that probably was this kicking off as well, but again, they're not going to look into that because it's so rare. So and I kept being taken into hospital, and they were like, no, you're fine, off you go again. They double check in there. And but it's funny, it's like a jigsaw. It starts to slot together, and things start making more sense, whereas they didn't before. And that, I guess, that's quite comforting, that you can find the reason sometimes behind things that have gone on in the past.
Absolutely. I think in my experience anyway, because we are we're biological beings. We've got the body and then the mind, and obviously they work together. But I always see the mind as like, my mentor calls it a problem-solving machine. So when it sees patterns, and it sees kind of the equations fitting together, it's like, oh well, this is why this is happening, and maybe this is why this happened. And I think that can be amazing, because you're like, oh, actually now it all makes sense. Or it can do the opposite. It can be like, oh my gosh, well then, it can sort of set, things off in you.
Yeah.
But I think, as you say, to have these kind of what we call these really minor symptoms, or stuff that like anyone can experience, to come back with the results that you did, I think is just, it highlights how important it is, to be aware, and also to, I guess, well, for me, it makes my situation, my experience is a little bit different, but on your behalf, I feel so grateful that, once things kicked off, that, it sounds like you were in good hands, and probably for the most part, to be in a system of care which has made sure that you're looked after. I mean, that probably sounds like I'm speaking for you. Do you feel that way? Has that been your experience?
They have been great, and I just think it's just really important. I mean, I could have so easily stopped going to the gastro, because every time I went, he was like, oh, you're back again. Oh, it's gone down again. But you must be doing some, have you got heavy periods? Nope. Have you got this going on? Nope. Do you eat, good diet? Yes. And I could have just thought, oh, he's not listening to me. I'll just, I'm just gonna, that's it, because no one's listening. But I think that's what I've learned through that, was it's so important to advocate for yourself. And but even with having that pain in that at night, that was the June, I didn't speak to anyone till September, and that was only because he asked me, because I was at the appointment. So I just didn't think anything of it at all. I thought, I don't know what I thought really. But yeah, it's definitely, I think advocating for yourself is so important, and chasing things. I have been lost in the system slightly occasionally, and I've had to push things. And I think I'm lucky that I can do that. I know, some people won't be able to do that. They'll think, oh no, the wait list is so long, so I'm just going to keep waiting. Not that actually you've dropped off the wait list because you've been lost in a loophole somewhere. So yeah, I think advocating yourself is so important along the way.
Absolutely. I couldn't agree more. From my own experience, I know you sort of have to become, your own everything.
Yeah.
And obviously I see it as working together, as a team, with my specialists, with my care providers, but ultimately it's my health and my life, and I'm kind of the centerpiece of it. So I think that's a really important note. You mentioned about your kids and your family, and obviously one of your children has the diagnosis as well. I mean, was this very, when things were happening with your health and what's happened since, was that very disruptive for you as a family, and how have you coped?
I guess I've always kept it. I've been very honest with them right from the beginning. We're very upfront with whatever was going on with my health. We were very upfront with them all the way along. I tend to try and take things in my stride. I don't overreact to things. I don't know. I don't know. I'm just very quite level with everything, and I think that has helped a lot, because then the kids aren't panicking. There's no one's panicking. It's just like, okay, this is the next hurdle. This is what we're going to do. So I've tried to keep it like that. And so actually, when my daughter was diagnosed, I was worried about, telling her that actually you are the one who's actually got this same thing as well. I think because I've been so open about my route with it, and blood tests or whatever, and scans and things, she actually has taken it in her stride so far. So we're under Great Ormond Street with her. We've got another appointment in December. She's having 6 monthly monitoring now, because all her levels actually seem okay. And I think we've got I haven't found many people. I can't remember the name of what our particular mutation is, but it's quite a rare one. And I think there's a handful of people that they've really investigated with it, and it's looking like it might appear first in adrenals over the thyroid, because every bit of literature I read was like, oh, by the time you're 40, you'll have medullary thyroid cancer, and I'm 42, and I was like, oh my gosh, you just go into panic drive. And even when they did an ultrasound on my thyroid before my op, and nothing flagged up, again, everything that I'd read was like, oh, it could be microscopic, it could be, but actually nothing had, when they then analyzed it afterwards and biopsied, there was nothing had started. So, and then seeing my dad, he hasn't had anything happen. We're doing a watch and wait approach, and again, that sort of goes against everything that I've read and everything that's been told to me, and so that was difficult. But actually, I feel better with that approach now that I've had mine out. Almost, they've tested it on me, and that's fine, and I'm 42 and she's 14, and so far, touch wood, she's fit and healthy. So we're closely monitoring for the foreseeable with her at the moment. So yeah.
It's really interesting you say that, because I know myself from my experience, and also talking to so many other patients, that particularly with the MEN conditions, but I guess a lot of other ones as well, it really is a balancing act of, watching and waiting, as you say, monitoring and intervening, whether that's medication or surgery or whatever it might be. And it's constantly going like this, and trying to work out, okay, what's, I've got this opinion from this person, I've got this opinion from this person, I've got my family saying this, my friends saying this, some voice in my head that says I should do this, and knowing what to do, when to do it, what the right decision is, can be so hard. And I've spent, cumulatively, I don't even know, probably days, worrying about, am I doing the right thing? Is that something you can relate to, particularly obviously with Florence as well, because you're I'm sure as a parent you feel some sort of responsibility as well.
Yeah, no, it's a big decision to make. Effectively, you're making a decision on their behalf, and what if we leave it too late, and what if it's what ifs everything. And even, but I mean, I don't know if I'm supposed to can say this or not, but when I went up to, we had her first appointment, I think it's 5 days post my thyroidectomy, and up at Great Ormond Street. And they said, oh, why have you had yours out? I was like, you can't put it back in, can you now? I said, well, that's what I've been advised by everyone I've spoken to. And I think my case, I think, is slightly different, is that it's it's mutation I don't know a lot about, but I think because of my breast cancer as well, the fact that I did have a Theo pop up as well, had another tumor up here, I think they were concerned that my body might be more prone to developing tumors, so let's just get it out, sort of thing. And that actually did make sense to me. I was like, okay. And it is so, like, what do you do, what you don't do, it's a big thing for a child to have that out as well, I think. And she loves theatre and acting, and is very sporty and everything. And I'm back to doing weights and a bit of running. I'm not a very good runner, but just trying and stuff, and all of that. But I'm not a singer, so but just I think they seem to be very on it with the right, let's just have her in every 6 months. As soon as anything does start to move on the bloods front or anything, then let's start the process, sort of thing. But until then, and sort of seeing the history of myself and my dad, and actually even because both my dad's parents, they were sort of, I think, late 70s and 80s when they passed away, and nothing was flagged like from that it was from anything to do with MEN, so that gives me a little bit of reassurance as well, added reassurance that we're doing the right thing at the moment. So yeah.
Absolutely. Yeah, well, I don't have kids of my own. But I know from when I was younger and my parents were going through it, that it's a lot of very difficult decisions to make. And you do, or they said, they ended up just having to sort of seek the best advice, really, and then trust, and trust who they were listening to, and that they were making the right decision. And I know that I've got here, and I'm where I am now in my journey, and I feel so grateful for whatever decision they make, because I think it's not an easy one. It can never be easy. So I think it's inspiring, and I hope that anyone who's listening back who's got kids or might be in a similar position can hopefully take some solace or just some inspiration, really, from what you've shared. I think it's a really powerful story. And I know myself, from you often upload pictures of Florence doing her sport or her drama or her music on your Instagram, and I always think she looks like she's flying. She looks like she's thriving.
There's nothing about her that you would be like, oh, there's something going on there. There's nothing. And I took her to the Amend day, and I was a bit like, should I take her, shouldn't I? And she was the only child there, but she absolutely loved it. She took so much from that, and reassurance, I think, from seeing so many other people there, that she actually really enjoyed it. And then we went off to Camden Market afterwards, and a bit of Portobello Road, and she loved that too. So it's just, I think, being open and honest, and not sugarcoating things, but not over dramatizing things. And you can't change what's happening. It's you can't change at all what you've been dealt in life and everything. So you've just got to go make the best out of it, I think, really.
You do, absolutely. Yeah, it's about how best to play, that hand of cards that you've been dealt, definitely. Well, we have time for one more question, and I wanted to ask you something which I do ask all my guests. If you were to kind of look back at yourself at the beginning of your health journey, or if you were speaking to someone who'd just been diagnosed, based on what you've learned so far and the experience and the journey you've had, if you could give them a piece of advice, what would it be?
I think it is, I said before, that advocating for yourself. Don't be scared for, to talk up, because I think with what I've learned is that with the breast cancer, I could Google. It's not a good idea to Google all these things all the time, but there's so much out there on that. Whereas with the men sort of diseases, or is that the right word? I don't know really. Men, there's it's very restricted. There's not much out there, and I was like, oh my, this is like a brick wall. Whereas I could, a ping of a button, find stuff about breast cancer. I couldn't with this. And I think it's finding the right team as well, and don't being scared to question things sometimes, and just go with it. I think, again, like I said, there's no point in getting work. I know, it's a shock having been diagnosed with different things, but you can't, like I said, you can't change it. You've just got to go with it and make the best out of it, and continue your life. And I think for me, I'm self-employed with my wedding flower business, and I've had to change that. I was doing lots of hands-on weddings, doing big weddings, and I've had to sort of change that, so it's more online based, and I now do more mentoring with that and helping others, which I absolutely love. But now that fits my energy levels, it fits where I'm at with my health, so everything's adaptable, and things happen for a reason, and you've just got to go with it, I think.
I love that. That's a great piece of advice to end on. Definitely. Kate, I can't thank you enough for coming on and sharing your time and your wisdom so generously. And if anyone listening back, gets half as much from this as I have, then that'll make me chuffed. And it's just so valuable always to hear different perspectives, hear what's going on, and I think particularly from your experience, what you've been through is, most people wouldn't even imagine, and where you are now, and the life that you're still leading in spite of it all, and your family as well, is really inspiring. So thank you so much for sharing.
No, pleasure. No, it's been lovely. Thank you for inviting me on.
Absolutely. And one last thing, if anyone wants to connect with you or follow you for any reason, whether that's flower based or mentoring based or health based, where's best to find you?
So I've got two Instagram accounts. So my flower one is the.little.flower school, and then I've got my sort of health journey and random stuff on what_Kate_did_next on Instagram. So yeah.
I love that. That's brilliant. Won't be forgetting those two. Super. Well, thank you again, Kate. And I don't think yours is a voice that we'll want to keep having around. So really looking forward to staying connected and hearing more about how your journey goes.
So much. Thank you.